Riverside County's mobile clinics provide prevention and early intervention outreach services to families who find it difficult to visit a county facility. Through these clinics, the county has improved access to effective mental health services, focusing on challenging behaviors in young children.
Well, our mobile PEI, which stands for Prevention Early Intervention, really developed out of noticing that there was such a need for mental health services outside of the standard clinics. Once children get early intervention, there's much less chance of mental health concerns later in life.
Back in 2008, the state released the Mental Health Services Act Prevention and Early Intervention Guidelines. And over the course of about a year and a half, we facilitated focus groups within communities, community forums. We developed a community survey that allowed the voice of the community to share with us what they believed the needs were for mental health prevention and early intervention.
Riverside County is very wide and diverse, and because of populations being in certain pockets, not every family could just hop in a car and drive to a clinic because of transportation problems. So it really came from seeing that need and then finding a way to match that need.
What came through very clearly to us was that there was a need for parent education and support. There was a need for access to services for unserved and underserved communities, and there was a need for individuals to be served where they are most comfortable.
These mobile buses drive straight to school sites. That way it's within walking distance for families of where their children would be attending school, and we're able to provide services right on the school site.
We worked very closely with a RV builder, a specialized builder out in Paris, California, and they helped us design the unit and built it from scratch.
Our first mobile unit actually began in October of 2011. All of our mobile units are two-team staffs of clinical therapists or psychologists, so they have at least a master's level training. We come out in pairs of twos for driving purposes. This is a 39-foot vehicle, so we do have 16 hours of training time, 8 hours in a classroom setting, and then 8 hours behind the wheel.
We had to do a 3-point turn. We had cones set up, and we had to get within 12 inches of these cones, driving in and out of them, and that was pretty intense.
Our mobile program goes to a particular school site every day of the week. So every Monday we'll be at a particular elementary school on a regular basis. And then Tuesday we go to a different part of the county at a different school site, same as Wednesday and Thursday. We actually run 4 days a week, Monday through Thursday, and we work 10-hour shifts because of the time it takes us to transport to a school location, set up, and then break down. With the bus, what will happen is we'll get a referral from the school district, or a family member might call us directly, and if so, we'll set up a time for them to meet with us on the bus. What you'll notice too is the outside's decorated with different facial expressions of children, because our families typically are having children with behavior problems. So if we would have had a portrait of a beautiful Norman Rockwell type home, I don't think they would have felt like they would be welcome here. So instead we have alternating pictures where we've got a kid screaming, and then a kid making a happy face, and then a child that might look frightened. And this really has drawn families to us. They've seen the pictures on the bus and they say, that's where I belong. It's been, I think, quite a success in terms of being full capacity at almost all of our school sites, and families really liking the convenience of being within their school district, walking distance to their home, because public transportation isn't always accessible for families.
One of the other benefits of a program like this is that it really cuts through the stigma of mental health services.
They all love it. Some kids call it the buzz, some kids call it the party buzz. They come in and it's all positive reinforced, because that's all of our programs are about positive reinforcement. So there's that level of comfort, and then also they're getting individual attention from their parents in this area. So we have parents that sometimes they're not sure about the services, or they're questioning things sometimes, and the kids really draw their parents and like, I want to go see the toys, and I want to go, play with mom, and it really helps build the relationship between the parent and the child too.
So even though this is a mobile clinic, it really is a miniature replica of what you would see in a clinic setting at a standard office. So our mobile unit is set up where we have a front lobby area, our family meeting room. Then as you walk down the hallway, we do have a restroom, since we're on for 10 hours at a day. And And then you'll actually come to our observation room.
So my role on the bus, I'm a therapist and I work with children who have a lot of behavioral difficulties. I work with them and their parents. And the way we do that is that I'm the clinician in here and I have this headset and I talk to the parents who are in the room over there with the toys and the child, and the parent has an earpiece.
And so we're able to coach the parent to respond different ways to acting out behaviors and defiant behaviors.
So I'm telling the parent all the skills to use. I'm helping them in the moment. It's in vivo coaching. And so that way the parent can take these skills and use them at home, in church, at the store, wherever they go, they know the skills. Because a parent can bring their child to me for an hour a week and I can get them to behave and be great and it's wonderful, but that does nothing for the parent when they go home. So this helps the parent in their home, in their environment, and it also helps to build that relationship between the parent and the child.
And so that's one of the therapies that we do. The other therapy is trauma-focused cognitive behavioral therapy. The parent's able to observe in the back in the observation room while we interact with the child in here, talking about things like their feelings, talking about what might have happened, giving them some psychoeducation, and the parent's able to observe and kind of fill in some of the blanks.
It's very appealing to kids, it's very appealing to parents, and they're willing to come here and get the services they need.
We're out in the community. We have 3 of these mobile units going out in Desert Region, Mid-County, and Western Region, which is the Riverside Corona area.
We're trying to reduce stigma, be available to the community, and in an atmosphere that makes sense for families to attend. They feel comfortable and they feel safe when their school principal says we have this service available, it's on site. It takes away the stigma of being referred to a mental health clinic.
If another county was interested in developing a mobile unit or a mobile program, I would encourage them to reach out to us. We are more than happy at any time to talk on the phone or meet in person. We could help other counties cut through some of the obstacles that maybe we face to start with, and we can connect them with a builder that has done a really good job.
It feels much more like a program that's offered at schools, so it's healthy and it's positive, and it's going to get my child to behaviors that make the family happy and make the child happy.